Assalamu alaikum. This is Dr. Tazeen from StudyMedic, and I'm here with MRCOG Part 1 Kickstart series. And the topic for today's discussion is perineal pouches. So let's have an overview that why this Kickstart series is needed. Actually, this is a YouTube series. So if you have not subscribed the channel of StudyMedic, please subscribe now and then click on the bell icon so that whenever the new series are uploaded on the channel, you can get a notification and you can benefit. When we discuss about anatomy and when we discuss about that what are the important areas which needs to be covered for anatomy, please keep in mind that you should have a clear idea about anterior abdominal wall, pelvic skull, and diameters are very, very important. Peritoneal coverings, peritoneal folds, and ligaments are important. Okay, intra-abdominal organs, you just should have an overlook. Blood supply and nerve supply is important. Kidneys, ureter, and bladder is an important area as far as exam is concerned. And the most important is nerve injuries and blood vessel injuries. They are very important as far as exam is concerned. And many exam tested questions are there from these blood vessel injuries as well as nerve injuries. So today's topic of discussion is perineal spaces and perineal pouches, which is a high yield area as far as exam is concerned. Basically, these perineal pouches, there is a superficial perineal space and there is a deep perineal space. The superficial perineal space is lying between the collis fascia and the inferior fascia of the urogenital diaphragm. So here you can see that this is the superficial fascia of the urogenital diaphragm, and this is the basically the inferior fascia of the urogenital diaphragm. So this is the membranous layer of superficial fascia, which is the collis fascia. And here is basically, this is the lining that this is inferior fascia of the urogenital diaphragm. So the superficial perineal space, this one is the superficial perineal space, which is actually lying the inferior fascia of the urogenital diaphragm and the membranous layer of the superficial fascia, which is collis fascia. So this is an important point to remember. And when we talk about deep perineal space, this deep perineal space, it lies between the superior and inferior fascia of the urogenital diaphragm. So here you can see that this is the superior fascia of the urogenital diaphragm and this is the inferior, and the space lying in between these two fascias, this is known as deep perineal space. Okay, so the perineal space is subcutaneous perineal pouch is there, superficial perineal pouch, and then deep perineal pouch is there. When we talk about superficial perineal pouch, it lies between the deep perineal fascia and the superficial perineal fascia. It is normally a flaccid space, but it is capable of expansion in cases of fluid collection, and the fluid in the space, it can spread throughout the triangle including the scrotum or labia majora, but it cannot pass posteriorly into the anal triangle or laterally into the medial thigh due to firm tethering of the posterior attachment of the subcutaneous fascia. So here you can see that this is subcutaneous perineal space, which is actually lying between the deep perineal fascia and the superficial perineal fascia. Then there comes superficial perineal pouch, as we discussed that it lies between the deep membranous layer of superficial fascia and perineal membrane. This is one of your exam tested area that actually they ask that what are the boundaries or what are the two layers which are forming this superficial perineal pouch. So inferiorly is the membranous layer of superficial fascia, superiorly is the perineal membrane, and on the lateral sides are the ischiopubic rami, which are actually forming the boundaries of superficial perineal pouch. The contents of superficial perineal pouch, that is another exam question, that bulb of the vestibule is there on each side of the vaginal orifice. Then crura of clitoris is there, superficial perineal muscles are there, bulbospongiosis, surround the orifice of the vagina and covers the vestibular bulb. Then ischio-cavernous muscle is there, okay, which covers the crus of the clitoris on each side, and superficial transverse perineal muscles are also there. Greater vestibular gland on each side of vaginal orifice, perineal branch of pudendal nerve which supplies the muscles and the skin. Okay, then there comes deep perineal pouch. As we discussed earlier, that this deep perineal pouch, it is completely closed space deep to the perineal membrane. So inferiorly is the inferior fascia of the urogenital diaphragm. Okay, then superiorly is the superior fascia of the urogenital diaphragm, and between this inferior and superior fascia there lies the deep perineal pouch, and laterally are the inferior portions of the obturator internus fascia. Okay, so here you can see that these are the membranous layer of the superficial fascia. Here you can see that this is the superior fascia of the urogenital diaphragm. Okay, and the deep perineal pouch is basically lying between these two spaces, which you have to remember for your exam, that inferior fascia of the urogenital diaphragm and superior fascia of the urogenital diaphragm. The contents of the deep perineal pouch, again, they are very important. That is basically comprising of part of urethra, part of vagina, sphincter urethrae muscle, which is pierced by the urethra and vagina, deep transverse perineal muscles, internal pudendal vessels, and dorsal nerve of the clitoris. So any one of the contents among these, this can be asked in your exam, that which is the content of superficial perineal pouch and which one is the content of deep perineal pouch. So you have to keep this in mind, that this is frequently asked exam tested area, and you have to pay attention to this thing for your exam preparation. Now, how the exam question can come up, that there can be various arrowheads, or there can be various points where the image can be given for your exam, and you have to answer that what is actually the structure is, or what actually the space is. So here you can see that there are few areas which are basically masked, and the question can come from these areas. So now let's see that what actually these pointed areas are and what can be asked in the exam. So have a look that first of all they are asking about deep perineal space. So this deep perineal space is lying between the superficial fascia of the urogenital diaphragm and inferior fascia of the urogenital diaphragm, and this is the deep perineal space of the superficial or deep perineal space. Okay, then they can ask you about the superficial perineal space. So the superficial perineal space, as we discussed, that this is the space which is inferior fascia of the urogenital diaphragm. Okay, this is the inferior fascia of the urogenital diaphragm if you follow the arrowhead, and this is basically the membranous layer of superficial fascia, which is known as Cooley's fascia. So the space between these two fascias, which is inferior fascia of urogenital diaphragm and which is membranous layer of the superficial fascia, this is superficial perineal space. So here you can see that this one is superficial fascia of the urogenital diaphragm, this one is inferior fascia of the urogenital diaphragm, and this one is actually the membranous layer of the superficial fascia of urogenital diaphragm, and this is also known as Cooley's fascia. And the spaces between these fascias, they are further divided into superficial perineal space and then deep perineal space. Another exam tested area, as I told you, that they can ask the contents of these pouches in, so you should have a clear idea that which structure is in which perineal space. So where is Bartholin gland located? And the options are deep perineal pouch, superficial perineal pouch, ischiorectal fossa, pudendal canal, and urogenital diaphragm. And as we all know that the Bartholin glands, they are in the superficial perineal pouch, and the other contents of superficial perineal pouch, you should have a clear idea that these are perineal muscles, bulbospongiosis, ischio-cavernous, and crura of clitoris. And when we talk about deep perineal pouch, so deep perineal pouch is actually containing deep transverse perineal muscles, external urethral sphincter, and bulbourethral glands. Now, please don't get confused between Bartholin gland and bulbourethral gland. Bartholin gland is component of superficial perineal space, and bulbourethral gland, that is component of deep perineal pouch, which is important point to remember for your exam. So join StudyMedic channel, YouTube channel, subscribe it now and get benefited for these Kickstart series which are specially designed for your exam preparation. I wish you all the very best for your exam. Thank you.